I'm Drrodrohrich. I'm a board-certified plastic surgeon in Dallas, Texas. I'm a facial aesthetic surgery expert, and I want to share with you my thoughts on fillers, the aging process, and when you need a facelift. I see so many patients every week that have had too much fillers in their face. They look completely different and abnormal, and sometimes they don't even look humanoid. So I'm just going to give you some advice on when to stop fillers, and for that matter, when to start them, but when to stop them and when you can no longer have them. And if you do, you look overdone, you look overfilled, and you will look like a, Stay Puft Marshmallow. You don't want to do that. And as a plastic surgeon, we have an obligation to tell our patients, and I do that every day. When I see the spectrum of patients, the youthful patient, the 20, 30-year-old patient, and I discreetly help them on when we can put fillers in. Usually it begins around the lips or the jawline and the early chin area where you get some facial fat loss and you get some hollowing and actually some sagging of skin. But I think one of the most important things to understand is, as we age, we lose soft tissue and mainly fat in our deep fat compartments. And I described that in The Science of Aging in multiple articles in the Journal of Plastic Reconstructive Surgery. And if you want more information about them, please email me or leave a comment, because how humans age is very predictable. We lose our deep fat first in the central face, eyelids, temporal, lateral cheek area, and then eventually that's structural support of our entire face. And then eventually what that does, it then allows for sagging of the skin. So that is the explanation for when and how to do fillers, and also when and how to do facelifts. Because I also see a lot of not so great facelifts because they don't understand the science of aging, and they just pull the superficial layers and it doesn't look good. They look windswept. They don't look like themselves. I mean, you don't want to look like, the overdone Kenny Rogers or somebody like that. Because as plastic surgeons, we are in the face protection program, not in the witness protection program. It is our obligation to tell people to continue to age gracefully, but more importantly, to look natural and to look youthful. So let's start with the youthful patient. I think in the youthful patient, fillers are great, and I use them in combination with Botox or a neuromodulator, especially in the lower face. So often I'm asked to do some highlighting of the cheeks, and I will do cheek fillers. There are 4 different points to place them: in the high cheek, in the deep malar fat pad, the nasolabial fold, and also in the nasolabial fold and in this periapical area. And that gives you beautiful highlights that you can see, much like in a facelift. And then also, if they want a larger lip or they have some lateral chin hollowing, those are excellent areas. And the lip itself, of course, is very popular. And then even the nose, and that's a whole other topic for another YouTube on when to do nasal fillers, because that's a different level of expertise and it can be dangerous if not done well or by someone who doesn't know or familiar with the anatomy. So in general, when doing fillers, there's several different principles. Less is more, and be very, very thoughtful about the anatomy. So as a consumer, you don't want to just get pumped full of fillers because it looks very different. First of all, there's a lot more bruising, swelling, and fillers are not necessarily reversible. Even hyaluronic acid fillers, if they're overdone, they're inspissated, means they're kind of in the soft tissue and the deep layers, and sometimes you can't reverse it. Even with hyaluronidase, the drug that actually is used to melt hyaluronic acid fillers, which are most of the approved fillers in the United States. So just remember, find an excellent injector, board-certified plastic surgeon, dermatologist or facial plastic surgeon, or oculoplastic surgeon that has expertise in this, who will also take good care of you and your face, because I say no half the time to my patients who want more fillers in their lips and their cheeks, and I just won't do them because that's my signature. I will not overdo somebody so they look different or strange, and it doesn't look good. So in long term, they will regret it. And so as we age, most fillers today last about a year. So you can actually begin to do fillers, and then don't stack them, because remember, fillers aren't completely gone even after a year. So less is more. So inject less, inject very discreetly, small amounts in areas, know your anatomy, it's very important. So when should you stop with fillers? Well, here's the big clue. Once you start having significant jowling here, you can't keep chasing that with fillers, because then you'll have this incredible overdone lip and chin, and we've all seen those patients. I see those every week, and it makes me very sad, because it takes somebody who's an attractive woman or attractive male, and it makes them look very different, very strange, and sometimes non-humanoid, and you don't want to be part of that. And I think as a physician, do no harm. First, before we're a plastic surgeon, you have to guide your patients and tell them, no, that's not the right thing to do. Every week I'm melting lip filler and tear trough filler, which is really something that probably should only be done very discreetly in a small select group of patients that has very early signs of aging. So know before you go, less is more, and be discreet. And you can do jawline fillers as well, but as soon as you get the cardinal sign of jowling, it's time to stop, okay? Then you must transfer to a surgical lifting. You can do the minimally invasive non-surgical methods, but if you have significant jowling, even radiofrequency type technology isn't going to be strong enough to camouflage that jowling without making you look distorted. Remember, jowling has to be corrected by lifting and filling. And then you get into the science of doing a facial rejuvenation, and that's a facelift, a real facelift. I know there's a lot of hype out there about the different types of facelifts. Deep layer, superficial, deep plane. I mean, none of this is new. The key is you have to understand the science of aging. So you have to fill the central part of the face, the deep and superficial layers, very discreetly, selectively. And I've talked about that a lot in several different YouTubes. And then you have to lift the outer layer with a deep layer facelift, a deep plane. It doesn't matter as long as it's safe and you know what you're doing. And you really need to see somebody that does this all the time, that understands facial aging. Look at their results. Make sure they don't look strange, they look different. And that they're showing you results that aren't a day or a week or 10 weeks old, or a view that's probably not the same as a pre-op view. I see that all the time. So when you're in the arena of a facelift, then you do the following. You find a board certified plastic surgeon or facial plastic surgeon that's an expert in facial aging, that understands facial aging, that's not gonna overdo your face, because these things are not reversible. It's not like a filler. If you have an overdone face, overdone eyelids, these are tantamount to a bad secondary nasal deformity. There's no turning back. So selecting your facelift surgeon is very important. So the moment you have significant jowling, it's time for a facelift and a neck lift. So I hope this has helped you understand the difference between fillers and facelifts, and when one is indicated and when it is not, and when to stop. And as always, like and subscribe to my YouTube channel. My goal is to help educate you to be a better you, and so that you can make better selections for your health and your life. So thank you very much, and leave any comments you have. I'm happy to answer them for you.